Hi, I'm Dr. David Rowe from Rowe Chiropractic Offices, and today's condition discussion is headaches. Now, historically, chiropractors have always seen a correlation between misalignments of the spine and headaches, and very specifically, misalignments in the neck, the cervical spine. Now, just as a quick review, what's our normal alignment supposed to be like? The spine should be straight from the front view, and from the side view, we're supposed to have a slow sweeping curve in the neck, the mid-back, and the low back. When our spine is like that, our structure is as strong as possible, and most importantly, our nerve system can flow and function at its best. But what if we have a misalignment in the spine, where the spine subluxates, misaligns out of its normal position? It's common that could put stress on the nerves. Now, whether a patient saw the chiropractor for headaches or they went to see the chiropractor for other conditions and they also had headaches, patients and chiropractors have seen when you reduce the stress on the spine and the nerve system, it's common for headaches to go away. The causation, the relationship, is that the misalignment in the spine causes tension, causes stress on different tissues, and that's what causes the headaches. Whether it be migraine headaches, cluster headaches, tension headaches, there's a correlation between changes in the spine, specifically the neck, or most commonly the neck, and the creation of the headaches. So if the chiropractor can find out what the misalignment is, what the subluxation is, and correct it, then it is very common for patients to get tremendous relief from their headaches. Now, how do we find what the misalignment is? Well, everything has always begun with our discovery exam. During our discovery exam, we're checking the spine's posture to see how it's aligned. We're looking at the spine's neurology to see how that's functioning, and we're seeing if there's any undue stress or tension. How do we find that stress and the tension? Well, the discovery exam relies on both a physical examination, photographic studies to evaluate normal posture, and possibly x-rays. The x-rays will give us very specific information about the alignment of the spine to see if there's any misalignment that could be stressing out the nerves. We also check normal muscular function, and we check normal neurological function to see if there's anything impeding. If we do find a structural misalignment, a subluxation, then we can come up with specific strategies and techniques to correct it. But everything begins first with the discovery exam. Let's say a patient comes in complaining of headaches, and so we do the discovery exam, and then we find a misalignment. Well, how would you actually correct that misalignment? The chiropractic correction of subluxation has different techniques that are used as a combination in order to correct that. We use typical spinal adjusting to take the stress off the individual nerves, and then we'll do certain postural corrections to fix the overall posture so then the body can begin to heal. Those postural techniques are therapeutic exercises, in-office traction, home traction, but all of them are really built to correct the mechanics, correct the posture, so that we can take stress off the nerve system so that the body can begin to function. And by doing that, even though we weren't really treating the headache, the body's innate healing capabilities will then take the stress off of the nerve system, and the headaches can go away. Now, we see some common correlations, like misalignments on the top of the neck that are associated with headaches, or subluxations in the lower part of the neck, and that link is probably that those subluxations are affecting the endocrine glands, the thyroid. That could also be associated with different types of headaches. But the point on all of this is to look objectively and say, what is the misalignment? What is the stress? And then going through the process of, after we find the stress, of correcting it to take the stress off of the spine and the nerve system so that the mechanics can heal, that the muscles can relax, so that the stress can come off the nerve tissue, so then the body can heal, and then the headaches can go away. If you have headaches, or people in your family have headaches, it can be a tremendous help to get the spine corrected to reduce the stress that causes the headaches.